Today we're going to talk to Dr. Brad Lundahl, Associate Professor and Director of the PhD program in the College of Social Work. Thanks for talking to us, Brad.
Thank you for having me.
What are some of the challenges of child welfare work?
First, child welfare work is very important. That we have families who are very needy, very vulnerable, and they're raising children, and at risk is child abuse, child neglect, and that has long-lasting concerns across a child's lifetime. It's also not good for parents. I've worked with a lot of parents. None of them start off thinking, I'm going to hurt and abuse this child or neglect them. They want to do well, but then they struggle to do it, largely because they're needy. They face poverty, domestic violence, there's issues with addiction, there's transience, low education, poor history of work. So it's families who are struggling mightily often, trying to raise children in very difficult circumstances. So the child welfare workers have a large job.
Yeah. Well, so through the study that you're currently working on, what have you found to be some of the most helpful and unhelpful activities or characteristics of child welfare workers?
Yeah, so one of our PhD students, Chad McDonald, and I and some others have begun to work on a project where we went and searched the literature for the voices of the families. So these are the service users, or the customers, if you will, of child welfare. And we found 37 studies that reported on the narratives from these customers. And they had over 800 responses. And so we've tried to collect and organize those in such a way that we can begin to inform practices in child welfare, or see if we're kind of on the right page, if you will. And so what we've found is that families like forward momentum, they like optimism, they like clear plans, they like partnering with the caseworkers so that they're involved in trying to improve, and maybe whether it's get their child back or move through addictions or find housing, increase their stability. They like to be treated with respect and dignity. They don't like to feel like they're being cheated or being treated without honesty. That's a big factor. And they need resources. These families are saying that they need access to resources.
Okay. Well, what do you hope that this research will ultimately accomplish?
Well, it might be grandiose, but it's a start. I think listening to the voice of the service user, we can take that and begin to compare it to what DCFS is doing as far as hiring practices, their training, the training programs, how they're supervising, and then also maybe beginning to work with caseworkers to see what do they agree with as far as what the service user said, where do they disagree, and can we maybe begin to identify who that super caseworker is and what it is that they're doing, so that we can maybe help caseworkers be more effective in their work with these important and vulnerable families.
That sounds wonderful. Well, thank you so much for talking to us today. We appreciate it.
Thank you.